And now, America's healthcare advocate, Cary Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA, from Alaska to Florida, all the way to Hawaii. My producer, Mr. Darren Wilhite. I'm your host, Cary Hall. This is your show, America. Thank you for joining us and making us one of the most listened to talk shows throughout the United States, 294 affiliates strong. As I always say, thanks to all of you out there in the listening audience. If you want to follow me on Twitter, Facebook, Instagram, or LinkedIn, it's AHA Radio Show. That's AHA Radio Show. That's how you can connect with me on any of those platforms if you choose to do that. Also, our podcasts, which have become very, very popular, are on the following: Apple Podcasts, Google, Spotify, Spreaker, TuneIn, iHeart, Amazon Music, Pandora, Stitcher, SoundCloud, and YouTube. That's a lot of platforms. So every one of these shows, after they are done, are posted up on those podcast platforms. So you hear this show today is going to be very interesting. We're going to be talking with some folks from Blue KC about ACA, Obamacare, open enrollment period. Some of you call it ACA, some of you call it Obamacare, individual and family insurance. This is the open enrollment period. That's what this show is about. So you're going to hear a lot of information today. Well, maybe you're on a different plan, or maybe you need to get on a plan. You want to tell somebody about it, your wife, your husband, a friend, whatever the case may be. Go back up to those podcast platforms. The show will be posted up there under ACA, Obamacare, Blue Cross and Blue Shield of Kansas City. You can listen to the whole show over again. So that's an easy way to do this. And if you are looking for individual health insurance, or you're looking for Medicare and you're chronologically challenged, you can call the lovely Joyce Thompson at RPS Benefits by Design at 877-385-2224. That's 877-385-2224. And if you want to send me an email, if you have questions, comments, something I can help you with, the website, healthradio.us, healthradio.us. All right, in studio with me, Andre Hunter. Welcome, Andre.
Thank you for having me.
From Blue KC, and Angela Cheatham back. It's been a while, Angela.
It has. Hi, Cary.
Hi, we're glad to have you in here. So as I talked about in the opening monologue there, Andre, this is the opportunity that people have to either change if they're on a policy they don't like and they want to move to something else, or if they're not on a policy, maybe they don't have health insurance anymore, they got laid off, or their company canceled the policy, whatever the case may be. This is that opportunity. So how long does this run, and when does it start, and when does it end?
Yeah, so open enrollment, it's going to start on November 1st, and it'll run through January 15th. However, if you're looking for a January 1st effective date, you would need to make your plan selection or choice prior to December 15th. So from December 16th to January 15th, that would give you a February 1st effective date.
Okay, so now that sounds a little confusing to all of you out there. We're going to go through it one more time, okay?
Okay.
So the open enrollment period starts on November 1st. It runs all the way through January 15th. But if you want a policy to start on January 1, they have to be signed up by when?
December 15th.
Okay, so you want a January 1st policy, people. You've got to get it done by December 15th. If you wait past that, now we're looking at
a February 1st effective date.
Okay, so that there are your choices. So that's important to understand. So, it's better not to procrastinate in this case, because if you want it for first of the year, this is a great way to get it done, and the folks at Blue KC can do that. That's during this open enrollment period. That's how all of this works. So, Andre, let's talk a little bit about these plans. When they first came out, there was a lot of controversy and a lot of issues around them with different things, but they've taken hold now. We've got, I think, about total across the country, about 7 million people on these policies. So there was a need.
Yes.
The need is being filled. And there's a subsidy involved that allows these to become much more affordable. So number one, how does the subsidy work? And then number two, how do people find out about it, Andre?
Great. So the subsidies are credits that are applied to your monthly premium. It's solely based off your annual income, your household size, as well as if you're offered health insurance or what's called minimum essential coverage through another platform like work or a spouse.
That's basically how this operates?
Right. So if let's say you have a 2-person household and the annual income is $50,000. So when we run the quote, we put in $50,000 income, and based off that information, it'll tell us how much of a subsidy that you would qualify for.
And that subsidy, so if now we've got husband and wife and 2 kids,
Right.
How does that change the equation?
To qualify for a subsidy, you would have to make a minimum amount based off your household. So depending upon where you fall with Medicare being expanded in Missouri, depending upon where you fall, you may not be the children may not be eligible for that subsidy because they would be eligible for Medicaid or CHIP.
One of the other programs, but if they are eligible, then that's all factored in.
Yes.
So it's a lot easier for people. I know over the years when I was doing this directly as a broker that people got very confused by this. They would go up on the government website and they'd try to figure it out, and they'd call you up and they'd just be fit to be tied because they couldn't figure out what. If they call the folks at Blue KC directly, you will walk them through this process, explain that. So it kind of takes some of the fear out of it. And if I make a mistake, then I got to pay it back. Well, that's what happens if you guys do it for them. Then that helps them not have those situations.
Definitely. So what you want or don't want to do is try and calculate your income to where you receive a more favorable subsidy, because it's all based off your taxes when you file your taxes. So the information that you put on your application is going to be compared to the information that's on your tax withholding at the end of the year. If you made more than what you put on the application, you could potentially owe some of that subsidy amount back. However, the amount that you put on the application isn't set in stone. So if during open enrollment you say, I'm going to make $60,000 during the year, and then come March, it's a up year or a down year, you have the ability to go in, update your annual income, and then your subsidy will be updated.
Readjusted to whatever it's going to be. So if you made less, you're going to get more. And if you made more, then you're going to adjust it down. So at the end of the year, you're not stuck with the big fat penalty by the good folks over at the IRS. Now you got to pay more because you took more money than you should have taken.
Yes.
Yeah, and that's why, I always tell people it really makes a lot of sense just to call the folks at Blue KC, somebody that knows what they're doing. And kind of walk people through this, Angela, so they, so they're not trying to do this on their own, right?
Absolutely.
Yeah, and again, folks, this is one of the beauties of the Blue KC's right down here on Main Street. They're local folks, and they can help you. We're going to talk about plan designs and all the rest of that here as we go through the show. But you're not going to get high pressure sales tactics from these people. If you call Blue KC and say, "I just need to know how this works," you'll walk them through it, right?
We walk them through all of the quoting, the plan options, other options if there are any for that individual. But more or less, you will get every question that you have to some extent answered, or at least a very good understanding of how this works and your options.
Yeah, and as I said earlier in the opening remarks, don't wait until the last minute. You're shaking your head, and so Angela, no. People do this,
yes.
And then the phones lock up, and then the websites lock up, and the government website will crash. I mean, this has happened almost every year, I think, where at some point, if everybody's trying to get on and get these things, that thing just freezes up, and they start to have problems. If you really want that January 1 start date, it really is a good idea. Do it now.
Now is always better than later. You don't want to procrastinate, especially now with healthcare. Thinking that, it won't happen to me or I don't have any health conditions. And then come January 1, you find out something's going on. And now you have to wait until February 1 if we're still in open enrollment. If it moves past that open enrollment period, then you're kind of stuck with no insurance or a catastrophic or non-minimum.
So go back to that for a minute, because I think that's important. You don't do this, okay? And I don't need health insurance. It's not a big deal. And then you wind up diagnosed with a significant illness. Mm-hmm. And okay, well now it's March, and I'm going to go get an ACA policy. No, you're not.
No. You will have to do it during open enrollment or during a special enrollment, which would include some type of loss of minimum essential coverage, like you said, through an employer or a spouse's employer or something like that. But if you don't have that special enrollment period, now you would not be able to get a ACA policy or Affordable Care Act policy. The only plans that would be available at that time would be a short-term policy, but they don't cover pre-existing.
Yeah, that's right. And you may not be able to get a short-term policy because it doesn't cover pre-existing. So the message here, folks, is really simple. If you're thinking you want to do this, if you're thinking you want to change, you don't like where you're at, or you just want to see what Blues has got to offer at Blue KC, you pick up the phone and give them a call, 888-892-8220, 888-892-8220 is the phone number. The website is
BlueKC4U.com.
Yeah.
Okay, Blue KC. I know there was a piece to it, and I didn't know what it was. So it's Blue KC for you. All the information is up there, but do give them a call. They'll be happy to chat with you. We'll be right back after the break. We'll talk a little more about what's being offered. We're going to focus on SpiroCare a little bit, and then we'll talk about plan designs. Broadcasting here on the HIA Radio Network, coast to coast across the USA. Stay right there. We've got more.
Whoa, tell me, darling, am I right? Am I
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website healthradio.us, healthradio.us. If you have a question, send me an email. I'm happy to answer them. I get them all the time, and if I can help you in any way I can, I'll be happy to do so. My producer, the always perfect Mr. Darren Wilhite. I'm your host, Kerry Hall. In studio with me, Andre Hunter from Blue KC and Angela Cheatham, also from Blue KC. We are talking about ACA, Obamacare, whatever you want to, it as and call it. This is the time when you can enroll in an individual or family plan. This is the open enrollment period. November 1st through January 15th is when you can do this. If you don't sign up by December 15th?
By December 15th.
December 15th, you will not get a January 1 start date. So December 15th is the cutoff for a January 1 start date. You can sign up after that, but your plan doesn't start until
February 1st.
Okay, so there you go. That's it. If you want a January 1 date, you've got to get this done before December 15th. If you don't and you miss it, you can still get the policy, but it won't be effective until we get to February 15th. All right, so Angelo, let's switch gears here. SpiroCare is in what? Its fifth year now? Here,
I think is it fifth year?
I think it's
fifth year.
So this is this was when Blue Cross first rolled this out. This was basically unheard of, okay, especially for a health insurance company to be opening these kind of care centers. And then the model that SpiroCare has, which very interesting. We've got a lot of imitations out there now coming our way from some of the other carriers, but they're not what SpiroCare is.
No, they're not.
No, and they're not going to be. But so let's just talk about the SpiroCare clinic, the model, what is offered in SpiroCare, and then when we get into plan designs, there are 4 plans now in the model this year on the ACA plans that you can get SpiroCare as your primary care center. But let's just start, Angela, with how does SpiroCare work?
Thank you, Carrie. I'm so glad that you started with the beginning because I think it helps to tell the story of where we started. So SpiroCare started really based on the feedback of our communities, our members, with concerns around the complexity of healthcare, how to navigate healthcare, and then just access to care, affordable care. And so we really got together with focus groups with our members to come up with a solution. And out of feedback from our members, we developed SpiroCare. And that model is really based around what's called advanced primary care. And you may say, what does that mean? That is really primary care on steroids. SpiroCare members have access to a full doctor-led team of professionals that are there to support the whole person. That includes your doctors, that's MDs, DOs, that's nurse practitioners, that is behavioral health consultants, that's diabetes educators, that is, most importantly, really, is the care guide that with a clinical and a benefits background that are there to help you navigate your care. I mean, they will hold your hand through that process. If you need help finding a specialist outside of SpiroCare, if you need help navigating your explanation of benefits, we've all received those bills that are confusing, even to me at Blue Cross. But those care guides are there in place to walk you through that, make sure you understand that experience.
Yeah, and you said, healthcare is confusing. It's confusing as hell.
Right.
Okay.
Right.
People try to do this stuff on their own. They call you
Right.
up. I remember when I did this for 26 years as a broker. And I would tell people, do me a favor, don't go up on websites and don't try to do this. Just come in and sit down and let us
Yes.
walk you through it.
Yes.
Because it is complicated.
Yeah.
None of this stuff is that easy. And if you don't do it on a regular basis, it's hard to understand it. The beauty of SpiroCare is just exactly what you said. The average time that a person spends with a primary care physician in this country is 7.5 minutes. Well, let me tell you how it works at SpiroCare. Okay, well, we've had the doctors on from SpiroCare. We've had Dr. Sweat on here, your chief medical officer. We've had different doctors on at SpiroCare. When you go in there, you sit down with the doctor, you're in there for 45 minutes to an hour.
Yes.
Going through, you're shaking your head. Yes,
Yes.
it's funny. Going through your medical history and being able to sit there and talk to him about who you are.
Right.
And then when you made that comment about treating the whole person, that's what this thing is built around. Yes?
Yes, absolutely. And if you think about it, when you are treating the whole person, that helps reduce your chances of, if you're dealing with a chronic condition, if you've got that chronic condition management right there, that helps to avoid it escalating to something more critical or more severe. So yes, and that's from head to toe. If you have a visit with a SpiroCare provider, you have that whole team that is invested in that whole person health.
Yeah, and that is really important. So let's talk a little bit about cost, affordable health. One of the reasons this was put in place, Danette Wilson, CEO at the time, was with your team. This was her vision to do this. You've done it. It's become hugely successful. Talk about the affordability of this, because this gets rid of a lot of reasons people don't go see their primary care physician or don't seek care. Angela?
I think this is my favorite part. The cost for care in a SpiroCare center for your primary care needs. Can I get a drum roll? $0. $0 for your care in the SpiroCare Center. So you may ask, well, what services are in the SpiroCare Center? Those are your doctor's visits with your primary care physician. So that's your routine physicals. That's immunizations. That is and this is for your children. So those with kids, the kids can go to SpiroCare. Your teens, they can go to SpiroCare. The adults can go to SpiroCare. In addition to that, we have labs right there on site. So if you need a blood draw, you don't have to leave and go to a lab. You can get your lab drawn right there on site. And how much does that cost?
$0.
$0.
Yeah, and here's the thing. It's right there. You don't have to leave there and go over to LabCorp or
Right.
Quest or someplace. You're in the place where they're going to do it, and it's done and it's over.
Exactly. And not only is it lab draws, but we also have x-rays in most locations. We have x-rays right there on site. And one more time, Andre, how much is the cost for care, including an x-ray at a SpiroCare center?
$0.
$0.
You can't beat zero.
You cannot
Can't beat zero.
One piece before we go to break, because you mentioned it when we first started talking about this. This is one of the most unique features, and we've done shows on this before, of SpiroCare, behavioral health, right there in the center. So this is another thing that people are reluctant to deal with. Talk a little bit about the behavioral health that's offered inside the SpiroCare Center right before we go to break here.
So the behavioral health consultant is part of your care team. So if you think about it, if you're in with your doctor and maybe you've got a recent diagnosis, along with that diagnosis, it's often coupled with some behavioral health like stress. So with the SpiroCare Center, there is a soft handoff to a behavioral health consultant who can talk you through situational conditions to really aid you along that journey. So that really goes back to that whole person.
And that's the whole idea. It's the whole person care here. You're not going to see that in any of these other facilities that try to imitate this. This is what's unique about SpiroCare. If you want, maybe you want to learn about, maybe you're on something else. You know what? That really sounds kind of interesting to me. Call them at 888-892-8220, 888-892-8220, or go to the website, Blue KC for you. Blue KC for you. All the information is up there. We come back, we're going to dive into the plan designs. Now, we're going to tell you what's being offered and how it all works. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the fruited plain here on the HIE Radio Network. You can find out more about us by going to the website, healthradio.us, healthradio.us. My producer, Mr. Darren Wilhite. I'm your host, Kerry Hall. In studio with me, Andre Hunter and Angela Cheatham from Blue KC. We're talking about the ACA, Obamacare, whatever you know it as. These are the plans that are available for individual and family health insurance. The open enrollment period is November 1st through January 15th. If you want to get one of these plans, maybe you're on a plan you don't like, and you want to find out if there's something better out there. Well, we just talked about SpiraCare. You might want to take a look at that, especially when you realize that it's going to cost you $0 to walk into a SpiraCare center with your children, with your spouse, whatever the case may be, for care that's all being offered there. And you can get that kind of information and more by picking up the phone and giving them a call. 888-892-8220. 888-892-8220 or bluekcforyou.com. That is the website, bluekcforyou.com. Angela, how many SpiraCare centers are they and where are they?
We currently have 8 SpiraCare centers. They are conveniently located across the greater Kansas City area. And I'll just name them off. There's SpiraCare Liberty, there's SpiraCare Lee Summit, SpiraCare in Overland Park, Olathe, Shawnee, Wyandotte, Tiffany Springs, right in the heart, Crossroads, and then opening late this year is our SpiraCare Independent Center, and we're all so excited about that.
Yeah, that's been a while coming, but that's really, I mean, when you look at those locations, you've got access to this anywhere.
Exactly.
I mean, it doesn't matter where you're at. If you're in Olathe, Overland Park, you're in Independence, you know, you're up in Liberty, Tiffany Springs for folks north of the river.
Exactly.
Or if you happen to live in the city, maybe you're in Brookside or something, right down in the Freight House District. I mean, it's pretty good. It's remarkable how they've expanded and how convenient it is for people to get into one of those facilities.
Exactly. And so for someone like me, if I live out south, I can access one of the south locations, but I work downtown at the Blue KC building and I can go to Crossroads. So you have access to any of those locations.
Yeah. And the hours that they're open typically?
Hours are Monday through Thursdays, 7:30 to 6:30, Fridays, 7:30 to 5, and then Saturdays from 8 to noon.
So some great hours, great convenience, easy to do. You can schedule online, you can call, or you can walk in.
Kerry, we encourage you to call rather than walk in.
But I know people do that, okay?
Well,
but it is much better to call or go schedule online. That's the easiest way to do it.
We really encourage our SpiraCare members to call, and we do that because you can work with a nurse triage who can determine the best location that can get you in the soonest.
And that's important.
Exactly.
Yeah. No, so you don't go to the wrong place. And yeah, it might be easier to get into Overland Park than it is Midtown. If you've got something you absolutely need to get done, that's a great way to do it. Let's switch gears, Andre. Mm-hmm. How many plan designs are being offered this year? Let's talk about those, and then let's get into some of the different plan designs. Andre?
Yeah. Okay, so this year we're going to offer 16 plans total.
How many?
16.
Holy cow.
Yeah.
They better call and get information. That's confusing. 16 plan designs.
16 plan designs. 10 are in the metro area. 6 are in our rural area.
Okay, so you got 10 here in the metro, and then outside of the metro. So if you're up around Cameron, Bethany, Chillicothe, Harrisonville, etc., those are the 6 plans that are in the rural communities. Let's start with what's here in the KC metro.
Yeah, so there's 10 plan options. They're going to range between a $2,000 deductible plan all the way up to a $8,700 deductible plan. So there's plenty of plan options in between their deductibles, depending upon what you are needing with your insurance.
Yeah, so there's something there to fit everybody's budget and everybody's needs. But let's go to so here's one. This is the bronze plan, okay? And here you're looking at an out-of-pocket of $8,700, right?
Right.
But this is connected to Spira.
Exactly.
So let's go back to that a minute, Andre. And oh my God, $8,700. Well, wait a minute. You're not going to pay $8,700. You've got SpiraCare.
Right.
Talk about it.
So yes, that is a $8,700 deductible. However, as you mentioned, you do have access to SpiraCare, where again, any services done at SpiraCare locations are going to be $0. So unless you have some type of specialist or, God forbid, some type of emergency, that would apply to your deductible. But as far as just primary care, you can get that again at $0 at SpiraCare.
Yeah, and that is that's really important. You've also got telehealth on there. as part of it. So
Yes.
if you don't want to go to the Spira Care Center, you want to try to do it from home. Johnny comes home and he's got pink eye, conjunctivitis. You can pick up the phone and do.
You can do a telehealth call with the Spira Care physician, and that will still be at $0. As well, you can do it with any provider that's in your network, and it would be a $10 copay.
But if you do it with Spira, it's zero.
It's zero.
Yeah, and then they make up. They call in the prescription, you get the medication, you're done. So it's it beats the daylights out of going to urgent care and sitting there for an hour waiting to be seen
Right.
in a room full of people that are coughing and hacking, carrying on. So that telehealth has become extremely popular. One of the few good things that came out of COVID was getting people to actually start using it. And so let's talk a little bit about back to that Bronze plan. What about prescription drug benefits?
All of our plans do have prescription drug coverage. The prescription generics on that plan, they have up to a $50 copay. However, if the prescription is less than $50, obviously you would pay the lesser amount. So if the prescription is a $10 prescription, you wouldn't pay $50 for a $10 prescription. You'll pay $50 or the lesser amount.
Yeah, or if it's a $5 generic, a low-cost generic, then it's only going to be $5.
Right, exactly.
And in today's world, 90% of what we take in prescription meds are generic. So again, what I'm trying to do here is get across the point that you can look at one of these lower-cost plans like this Bronze plan with its $8,700. There's also a First Bronze and a Bronze Choice. And if you're using Spira, you can contain the cost and probably, Angela, probably 80% of what people do is with their primary care physician.
Yeah, it is, Carrie. And like you said, and like Andre has said as well, that is all available at no cost. I mean, you really do want to work with your primary care physician to manage that care.
So now think about this, folks. Okay, so you get a subsidy, all right, and the subsidy is paying for, in some cases, as much as 90%. Some cases, it pays 100% of the premium. You get a subsidy. You've got Spira Care. Your exposure here is pretty limited, right?
Very minimal, yes, sir.
Yeah.
Very minimal.
And the idea behind putting this in place, behind putting the ACA Obamacare plans in place, was to make affordable health insurance for people that couldn't get health insurance because of pre-existing conditions, or they simply didn't have the money. And that's all changed now, right?
All changed. So a lot more people are being eligible for those subsidies now. And again, the subsidies are going to bring those costs down quite a bit, just depending upon your income, but definitely makes it more affordable for a lot more people.
And subsidies have gone up, haven't they?
They have gone up.
And they've gone. Is it been substantial, or is it kind of incremental, or how's it going to?
No, it's quite a bit. I don't know the exact percentages, but it is quite a bit. And there's no cliff. There used to be a cliff where if you made 400% of the poverty level, you just weren't eligible for a subsidy. That cliff is now gone, so it continues to go up, but your subsidy amount gets smaller.
See, and that you just heard Andre say that's a piece that you would not know, okay? And you're not going to know that by going up on some website and trying to figure it out, which is why if you pick up the phone and give them a call at 888-92-8220, you will speak to Andre or Angela or one of the folks there that can help you and walk you through this process and say, oh, no, you qualify for this, which means it's going to pay 70% of your health insurance premium, okay? And then you look over here at one of these Bronze plans, and there are two of them here that have Spira Care, right? The Bronze,
Yes.
The Bronze Choice, and then and the Choice Bronze rather, and the 7,000 and the 8,700.
Yes.
Both of those are connected to Spira.
Both, yes. And there are also silver plans that have the Spira option available. They have a $5,000 deductible and a $6,000 deductible. So as you mentioned earlier, there's plenty of options and choices for anyone and whatever their health requires.
Yeah, and the good news is, there's something that's going to fit your budget as well as your needs. So that's the key to this thing. That's why we're doing the broadcast today, is to remind you that these options are out there and how they work, and also to remind you that the open enrollment period is November 1st to January 15th. If you want to get coverage in place by January 1st, even I get confused. Yeah, I mean, seriously, right? You think this,
Right.
You got to get it done by December 15th, right? Andre?
Right, for
And if you
January
don't,
1st.
you can still get coverage, but you're not going to have a plan in place till February 15th. So
February 1st.
See, I did it again. Okay? So that's why it's a good idea to pick up the phone, call them, let them walk you through it, let them explain it to you. And especially if you're really trying to manage a budget, and a lot of people are right now, inflation, there's a lot, the cost of everything is going up. This is one of the things that's going to make a lot of sense for you. Couple that with the subsidy, couple it with SpiraCare, it can make a big difference. Once again, the phone number 888-892-8220 or the website Blue KC for You. And that you can go up on bluekcforyou.com and information is up there. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Here on the HIA Radio Network, you can find out more about us by going to the website healthradio.us. Also, remember, okay, this is like drinking out of a fire hose, listening to all these folks go back and forth. Even I get confused, right? You want to tell, hey, you know what, we need to look at that Blue Cross plan. We need to look at that SpiraCare thing. All right, here's what you do. Go to the podcast platform. I gave you we're on every podcast platform out there. If there's one we're not on, somebody needs to send me an email, okay? And listen to the show. That way they can hear what's going on here, and they can hear the benefits, as Angela talked about, all the things that you can do with Spira and how you can keep the costs down and have great health insurance. So that's a great place to go to do that. You can listen to it up on the podcast platforms. They've become very popular. We've got a lot of people listening to these shows up there. So you can do that. You can also call 888-892-8220. If you just want to have somebody, you can talk to Andre. He'll be happy to explain this to you. He's right there with a lot of other folks up there. And the website is bluekcforyou.com. And Andre, this is one thing that I think we really need to talk about.
Okay. The
customer service at Blue KC, right here on Main Street, is world. You've won J.D. Power Awards for a number of years. It's great customer service.
Yes.
I called the other day because I had to change the billing on one of our policies, my wife and I's Medicare policy. Phone rang 4 times. Live person. There was no voice prompt. I got a live person. Told her what my problem was. She got another person on, transferred to her. We got the problem solved. I didn't have to go through 15 voice prompts in 12 languages, okay, and talk to somebody in another state that didn't even know what the hell I was calling about, okay, and try to explain it. So the customer service here, talk a little bit about it.
Yeah, as you mentioned, world-class customer service, and it's well-rounded. A lot of our people, me, myself, come from customer service, so you get that customer service feel even when you're speaking with the sales rep. But when you call in, you're going to speak to someone that could very well be your neighbor. Like you mentioned, we are right here, local, familiar with the area.
Yeah, and you try doing that when you pick up the phone and call one of these national companies. You say, I need to know about that hospital north of the river. What river?
Right?
Where are you? What are you talking about? That's the difference, people. Okay, yeah. It is your neighbor. It's somebody you go to church with, or somebody you're on the PTA with. That's what I'm talking about, and that's why local customer service, Blue KC, is here in Kansas City, throughout the metro, to help folks and do what, really gets you to be able to understand what it is they do. You've got a gift card option for people on, this is another little piece that's kind of cool. Yeah. Let's talk about that.
We do have a rewards program for our ACA members. Basically, all you have to do is get your annual visit, and we'll give you a $25 gift card. You simply just have to register online for the rewards. You do that at bluekc.com/ACA rewards. And then if you complete your annual preventative service between January 1st and December 31st, you'll get a $25 gift card simply for doing your annual visit.
Not bad. $25 for going to do what you should do anyway.
Awesome.
And by the way, those are all covered with no copay, no co-insurance. You go to the SpiraCare, that's 100% covered, the whole 9 yards. All right. 2 plans we didn't talk about. Let's start with HSA plans. HSA plans are popular with folks that are a little older, okay, because they, they're empty nesters, all the kids are gone, and you don't have a lot of medical issues. You're in pretty good health, and so let's talk about HSAs and how they work.
Right. So we do have one plan that would offer you the capability of getting an HSA or health savings account. $6,500 deductible, $7,500 out of pocket max. The plan, it doesn't come with the HSA, but you have the ability to speak with the financial institution and sign up for a HSA.
So the beauty of the HSA is they can put money in that plan every year. If you don't use it, this isn't like your flexible spending account, people, where if you don't use it, you lose it. These roll over every year. So let's say you can put $5,000 in there. All right, you only use $4,500, 500 of it. $4,500 rolls over the next year. You can put another $5,000 in there. It's tax deductible, which is another reason why people like to use it. Is because they're able to sock that money away over a period of years. You can take it out and use it for all kinds, dental, vision. There are all kinds of things you can use it for relating to healthcare, right?
That is correct. That is correct. Use it for anything related to healthcare, from your dental appointments or co-pays for prescriptions, even Band-Aids.
There you go. Over-the-counter Band-Aids. It's all covered under the HSA. So that, again, that's not for everybody, okay, but it is for folks that, really don't need all of the daily doctor visit services and all the rest of it. This may be a way that makes a lot of sense for you. And that plan is offered as part of Blue KC. There's also a catastrophic plan. Talk a little bit about that. What is that?
The catastrophic plan, that's a new plan to Blue KC this year. It's a little more specific. So people who are eligible for a catastrophic plan, one, are people under 30. So, those college students who are pretty healthy, doesn't have any health issues, that may be a look for them. People older than 30, you would have to have a hardship exemption or affordable exemption from the marketplace. So basically your job insurance or the marketplace insurance is too expensive. So you may be eligible to get the catastrophic plan. It's just another option.
So somebody's coming off their parents' plan because they're 26.
Right.
This is a very affordable option for somebody to do that. And that it makes a lot of sense for them, right?
It
kind of reminds me of the old Florida Blue back in the day.
Yes,
It's a while
for that
back.
one.
Yeah.
You took it back.
You're going far now.
Yeah, I know. Well, you weren't there, but Angela and I were. Okay. Yeah. So, but this is kind of like that. So again, the whole purpose in going through all of this today is, if you listen to this, look at all the different plan designs. I said this earlier. There's something there that's going to fit the budget and the needs of just about everybody out there. So it's an option that can make a lot of sense for folks. We're going to wrap it up here in a minute, but Angela, let's go back through the SpiraCare locations so people know where they're at and the options with SpiraCare.
Sure thing. So remember, folks, for your primary care services, you can go to SpiraCare, any of the SpiraCare centers. There's one at SpiraCare Liberty, Lee Summit, Overland Park, Olathe, Shawnee, Wyandotte, Tiffany Springs, Crossroads, and then the end of 2022 in Independence.
Okay, that's it. So there you go. That's where everything's at. Thank you both. Thank you, Angela. Thank you,
Thank you,
for
Carrie.
coming in today. It was great to have you both in here. The phone number, 888-892-8220. One of their folks would be happy just to chat with you. If you want to learn more about Spira or any of these plans, like the catastrophic plan, whatever, call them, 888-892-8220. The website, bluekc4u.com. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.